Well, I was overwhelmed, completely surprised and shocked, um, but felt completely honored, very honored, and humbled that this happened to me.
So, when a family comes to our clinic and receives a diagnosis from our physician group, the baby may have a particular genetic disease or birth defect. That's a life altering diagnosis. Shannon steps in pretty immediately to help provide consultation to the family about what to expect for the rest of their pregnancy. She will make sure that that family gets to meet all of the healthcare providers that their child may need, both at UAMS and at Children's Hospital, and in some cases in other parts of the country. She also is there to help guide them through planning for their delivery at UAMS. She's often in on deliveries at UAMS, and then she follows those babies and families pretty closely after delivery when they're getting their specialty care at Children's Hospital.
When I meet the families, that's where it starts, is the relationship that I kind of get with the family. This is, when you get the diagnosis of being pregnant, that's supposed to be the happiest moment of your life. And so then these patients come in here and the majority of them get a very devastating diagnosis of their baby. So that's where it begins, where I'm then their point person here of the relationship that I begin with them. I try to empathize with them on the diagnosis that they get. I become their contact here in the program.
But more importantly, I think Shannon's compassion, her ability to put herself in these families' shoes and understand what they will need emotionally and medically to get through the process of making the diagnosis and getting the care for their children is her best quality. She often spends hours on the phone with these families, crying and praying with them. So even if it's not concrete, specific things that she's doing for the family, she may just take the time to be with them in their moments of worry and despair in some cases. The other thing I really admire about Shannon is her tenacity. She is a bulldog, and she's going to get these families exactly what they need. She's going to get all of their questions answered. She's going to make sure that they get the best medical care possible in Arkansas. And she follows up with those families long term, really forms a long term relationship with a lot of them. So she's aware of how their kids are doing, even 4, 5, 6 years out from being in our program. And I also just enjoy learning from her. I mean, I learn from her every day. Her experience in the NICU and what these babies go through on a day to day basis is invaluable both to our patients, but also to us who work or have worked mostly in the prenatal setting and not seeing what these babies go through on a day to day basis after they're born. So I feel like I learn from her constantly.
So I feel honored to be named MVP. I feel that I'm now being recognized for a job well done by my colleagues, by my team. It makes me feel good that that they think that I do my job well.